Coronavirus has killed 12 more people in the last 24 hours, raising the country's fatalities to 825. At the same time, Kenya continues to witness a surge in the number of COVID-19 cases, with the Ministry of Health reporting 616 infections under 24 hours. And with the country's capital city still leading with the number of infections, the Nairobi Metropolitan Services has embarked on a mass testing exercise to establish the true burden of the disease in the county. KTN News Health and Science reporter Beldin Waleula with the details. Rattled by the current surge in the number of coronavirus cases being reported, Nairobi Metropolitan Services has once again launched COVID-19 mass testing. The two-day exercise was launched in Kibra, with more than 200 people turning up for screening, and is being conducted in 17 other sub-counties in Nairobi for free.
Looking at the rate of people that are dying in Kenya because of this disease and other countries, I wanted not to be one of them.
Wala dozi nilikuwa nafanyanga nao walienda kwao na naona wamerudi na wameniambia ni hakikisha nimeleta barua ya COVID-19 ndio kwa maana nimekuja kutest.
Many residents of Nairobi appear to have thrown COVID-19 caution through the window despite the spiking numbers. A carefree attitude has already set in, with those who turned up for screening constantly being reminded to maintain social distance. NMS Health Directorate admitting that indeed the mass testing was informed by the increased number of coronavirus infections in the county.
What Nairobi does is very important for the whole country, because if we manage to contain COVID-19 in an epicenter like Nairobi, then we have helped the whole country.
The samples will be tested at Mama Lucy Hospital, where a laboratory has been set up to ensure those tested get their results on time. The testing is meant to ascertain the burden of the disease in Nairobi County.
Now, in Nairobi, we are already sure there's community transmission. So what we are looking at now is the burden of disease in the community.
While the Ministry of Health had earlier cited mass testing as unsustainable, Dr. Oluga is convinced that mass screening is important for better planning and review of strategy if need be.
Based on this data, we will inform our strategy moving forward, and then after that we can determine whether we need to either do this strategy again or another strategy.
This comes as Kenya recorded 616 new COVID-19 infections out of 5,512 samples tested. From these tests, the country positivity rate jumped to 11.2% from 10.1% reported on Friday. The new infections raising Kenya's caseload to 44,196. At the same time, 12 more patients have succumbed to the disease, with the number of fatalities now standing at 825. Meanwhile, 104 people have been declared COVID-free. Beldin Waleula. Away from the COVID-19 numbers, police in Malinya, Ikolomani in the